All right. Good evening, everybody. Thank you for joining us. We know we have several more folks that may be joining us as we go. I'll try and make sure that we don't have the doorbell on. But thank you for joining us tonight. And I'd like to introduce Donna Walsh and Kevin Baker with the Florida Department of Health in Seminole County to share with us some updates on COVID-19 protocols and working with the health department and getting their guidance as we navigate our continued increase in cases in childcare centers. Just a quick reminder to everyone, we have sent out a new way for you to report to me at the Early Learning Coalition of any closures. We have a form that you can fill out electronically. It was sent in the constant contact last week. And if you send me an email, I'll probably send you the form link, but hopefully that'll save you time in reporting COVID closures to us so we can pay for any absences we are allowed to pay for. And with that, I'll pass it off to Donna Walsh and Kevin Baker. Thanks for joining us.
Thank you so much, Jennifer. Actually, I'm going to introduce Kevin, and he has a presentation for your members here, and both of us will be available, as well as I see a couple members of his epidemiology team that'll be available to answer any questions that anyone may have. So with that, I'll introduce Kevin Baker. He's our epidemiology manager.
All right. So good evening, everybody. Thank you for taking the time to come out and be with us this evening. This will hopefully be insightful and helpful for everybody. I'm sure everyone's had their own level of involvement with COVID, willingly or not. So we're here to kind of help squash any myths, handle any technical issues, logistics issues, and reporting, making sure you have the latest and greatest guidelines. So that way you are able to feel like you can do your jobs effectively and keep your staff and attendees safe. So with that being said, I'm going to try my hand at sharing my screen. So just let me know if you can see it in just a second. It gets a little confusing. Let's see, so let me get back to Zoom. Sorry, it's giving me a little bit of a hassle here. Okay, so let's try that. Do you see my screen now, the full PowerPoint?
Yes, we do. Thanks, Kevin.
Okay, awesome. All right, so we'll go ahead and get started. So that's just me. I'm the epidemiology program manager. So I oversee the COVID-19 response unit. So for disease reporting and contact tracing, COVID-19 is a reportable disease to the Florida Department of Health. I think some of you may be familiar that we may have worked with some of you on outbreaks before. So there are plenty of other diseases that we may be contacting you about other than COVID. You all may be familiar with hand, foot, and mouth disease, norovirus. We had a big cluster of GI illness going on for a few months a while ago. Flu season's coming up, so I'm sure you may be seeing some other respiratory illnesses spreading around. Chicken pox, another common one for children. Whooping cough. So we do investigate about 60 to 70 different diseases in my department. But COVID, as you can imagine, has totally taken control, and that's pretty much the most of what we investigate these days. So just to give you a kind of a brief understanding of my department's role. And so just for your awareness, and a lot of people don't know this, but the Florida Department of Health is exempt from HIPAA, and that's in terms of disease reporting. And that's because we're public health and what we do, in order for us to be able to control the spread of COVID and other diseases, that information can be willingly passed on to the health department so that way we can do our jobs. A lot of doctors' offices and stuff that do testing, when you go visit them, will have you sign some privacy, paperwork stating that, the information that, that's collected from test results or whatever could be reported to the health department. And so that's on the healthcare provider side. But in other realms of like childcare facilities, schools, they also do report to us in order to help stop the spread of disease within their facilities. So that's a bit of a background in terms of how epidemiology works. And we are backed by Florida statute, as you'll see here, as well as Florida Administrative Code. And we can always provide that to you all if any of you want some light legal reading. All right, so what are your responsibilities? So first of all, the main thing, we want you to report cases of COVID-19 and their close contacts to us. And the way that you can do that, and we'll get into some details in a second, is to fill out the COVID illness report log and send that over to us at the health department. And then please contact us. We definitely want you to reach out to us if you have questions. Please don't try to feel like you have to figure it out on your own. I'm sure many of you are capable at figuring things out by looking at guidance online, but if you haven't been on CDC and Department of Health's website, the guidance is quite extensive. And trust me, we work on it all the time. I have Maria and Alex with me. They are my COVID response lead and my childcare facility response lead, respectively. And so they know this information like the back of their hand. And so we're here to make sure that you have the latest guidance and to help you get this under control. And what I just like to remind you all is that we're all on the same team here. This is not any kind of punitive follow-up. We're not here to get you all in trouble. Our job here is to help keep your staff and attendees safe. Like, that is our goal, is to stop outbreaks from occurring. So please do not hesitate to contact us, and we'll have that contact information at the end of the presentation. And then we're going to talk a little bit more about exclusion of cases and close contacts, which include the isolation guidance for cases and quarantine guidance for contacts. You may not know isolation and quarantine are not interchangeable terms. So the one is for those that test positive and one is for those that are exposed. So we'll get into that. And then we'll also talk about cleaning and disinfection as well, among some other topics we'll get to a little later. So this is a screenshot of what a COVID illness report log is going to look like. So you'll see at the very top in the light blue, you have the facility's name. So you'll put your facility's name in there. What your census is. So we want to know how many attendees and staff you have in your facility. If you can give us a very close estimate, even I know there's some fluctuations that happen, of course, from day to day or week to week, but if you can give us a general idea of how many staff and attendees you have, that would be great. We want you to put the date that you're sending this over to us, and as well as the name and phone number of the person that's reporting it. So that could be the operator of the facility. It could be an administrative staff they have helping with it. Whoever it is that's going to be reporting it, we would like to have their name and phone number so we can reach out for additional questions and concerns. So you'll see in this very first section, you'll see a black bar that says sick attendee / staff member. So you're going to fill one of these out for every single case that you have of COVID in your facility. So if you had three cases, then you're going to fill out 3 separate onus report logs. So for the first one, the sick attendee and staff, you provide name, date of birth, classroom, gender, parent phone number, so on and so forth. And you'll be able to fill this all out for that individual. And this helps us be able to link that case to your facility. Then, below that, you'll see the second black bar about the direct contacts. So you're providing just about the same exact information as you are for the cases, minus a couple different pieces, such as if that contact was fully vaccinated. So we know, obviously, for most of your attendees, that's going to be no. But for your staff, they could be vaccinated. And if they decide to provide that to you, you can put that in. We just ask that if you don't know the answer, either because they didn't provide it to you or you weren't able to research it yourself, just to put a U for unknown in that column, and try not to leave any of the fields blank. That really is helpful to have every cell filled out. Then we want to know the date of the last COVID exposure. So essentially the last date of the childcare facility, sometimes you might not find out about someone being exposed until much later. So for example, if a case of COVID-19 was last at the facility today, but we didn't find out about people being exposed until a couple days later, then they may have been last exposed to that COVID case today because that COVID case was excluded, but the child may have still been at the facility for a couple of days. So we do want to know when was the contact's last date at the facility, And then basically the last date of COVID-19 exposure would generally be the last date they were exposed to the positive individual at the childcare facility. So then we also want to know if they're a staff or attendee. And then it'll automatically calculate what your two different criteria are for clearance. So the first is called the time-based clearance. So this will be, we'll get into the details of what that means. And then for test-based, this tells you the earliest date that someone could get tested in order to be cleared from quarantine. And then if that result is negative, then the last column in orange will tell you the date, the earliest date that person can return back to the facility. So we'll basically do all the math for you in this spreadsheet. So you don't have to do any of the calculations. It really helps you out. But like I said, it's going to be very important that you do complete all of the cells in each row, so that way it does populate the right information for you. And just so you know, those dates that are going to auto-populate in these last three columns, those are related to the date of last COVID-19 exposure column. And then the clearance will be the same for both staff or attendees. Okay, so for cases of COVID-19, it's very important that you determine what the contagious period is for each case. So if it's a symptomatic case, so the child, the parent or the staff member reported some kind of symptoms, then we're going to consider them to be contagious for 2 days before their symptoms started, up through at least 10 days after their symptoms started. And then for if they're asymptomatic, they have no symptoms, then we're going to say 2 days from before the date their specimen was collected through 10 days after that specimen was collected. So essentially on day 11 after symptom onset, if symptomatic, or on day 11 after their specimen was collected, if they did not have symptoms, day 11 would be the day that they are cleared from isolation. And again, isolation is what we say for people that are positive. And so then for every case, like we talked about in the illness log, you're going to identify all the close contacts in the facility. So that is defined as someone that was within 6 feet of that individual for at least 15 minutes cumulatively over a 24-hour period. So let's say they were together at lunch and then they were kind of doing their own thing. And then, they came back and spent another 5 minutes, and you kind of add up all those times together. If they've spent at least 15 minutes within 24 hours with that contagious person, then they should be added to that log and considered a close contact, and they should be excluded from the facility until they've been cleared. So as mentioned, of course, report the COVID case and illness log to us at the health department. And then we will provide you all with a notification letter for your staff and attendees. So it comes very official, has my signature on it, to let everyone know about about the exposure and when they can come back to the facility. So symptomatic cases can return if it's been at least 10 days since their symptoms first appeared, and at least 24 hours have passed since they've had a fever, and they have not used a fever-reducing medication, as well as they have to have had overall symptom improvement. So again, I mentioned day 11 earlier, so it should, on the 11th day after symptoms started, as long as they've been fever-free for 24 hours without using like Tylenol or Advil or Motrin, and their overall symptoms have improved, like they're having their cough has improved, or a sore throat has improved, or any other COVID symptoms have improved, then they can return back on that 11th day. If their symptoms are still very bad, we would recommend that they end up going and getting checked out by their pediatrician or their PCP. But we are more than happy to have those conversations with them as well to make those recommendations. But ultimately, you're generally going to be following this guideline for symptomatic, given that most of your attendees and staff will likely recover within that 10-day period if they don't have like a very severe illness. So then if they are asymptomatic, then they can return after 10 days have passed since their test was collected. So, so those are the two criteria based off whether they're symptomatic or asymptomatic. So for close contacts, this is quarantine. So again, quarantine is for the exposed. So there's two options. There's a time-based strategy and a test-based strategy. So for the time-based strategy, they will have to quarantine for 10 full days after the last exposure, which, as if you can recall, that's listed. You put that in the illness report log that you send to us. So you'll count out 10 days. They have to quarantine for those 10 days, and then on day 11, they're able to return. It should be very important that you all remember, though, that CDC's guidance is that the gold standard is to quarantine for 14 days. And the reason they say that is the full incubation period for COVID is 14 days. Now, CDC, due to, of course, understanding that people are trying to get back to their lives and it's hard to stay out for longer, and based off, the science, they were able to bring that down to 10 days. As what they're going to allow people to return back after. But technically that gold standard remains at 14 days, because then we would say by day 15, we would feel very confident that that child or staff member would not come down with COVID-19 15 days or later after that exposure. And then there's option 2, which is the test-based strategy. So they would quarantine at home for 10 days, for at least 6 days. On the 6th day from the exposure, no earlier, on or after 6 days, they can get a PCR test. If that PCR test comes back negative, then they can return back on day 8 from their last exposure. And so with that, there's a lot of people that run off to get the rapid antigen test. The rapid antigen test for this strategy does not apply. So if they get a rapid antigen, that should not be accepted as means to return back to the facility. It should be a test called a PCR. And then again, you all are going to have the date of last exposure. So on that, it'll tell you on that list, when you add that date of last exposure, it'll tell you when can they return back, or when's the earliest date they can get their test performed. So it'll already tell you. So if they bring you back a PCR and they were last exposed on the 14th, but they got their test collected on the 17th, that test result is not going to work because they are supposed to wait 6 days. So if they were exposed on the 14th, then you have to count out day 1, 15, day 2, the 16th, day 3, 17th, day 4, 18th, day 5, 19th, day 6, the 20th. So they cannot get tested with a PCR any earlier than September 20th, that they were last exposed today. And then if that test is negative, then they can return on no earlier than the 22nd, which is 2 extra days after this day 6, which is day 8. So again, PCR on or after day 6, and then they can return on day 8. And then it has to be PCR, cannot be an antigen. So going over some prevention measures, some other things to consider. I think we all know, again, talking about all of the diseases that we work with, hand washing and cough etiquette and sneeze etiquette, extremely important. Making sure tissues are available, teaching our vampire cough, bring in your elbow over your nose and mouth as opposed to your hands. Making sure that cleaning and disinfecting liquids and those disinfectants can be available for staff to spray down surfaces in the rooms and the common areas. On toys, if toys get coughed or sneezed on, those should be pulled from circulation and disinfected. And there is a list from the EPA that has all the disinfectants that are approved against SARS-CoV-2, which is the virus that causes COVID. Or you can use a bleach solution, which is 1 part bleach to 10 parts water, and spray down the object or surface. And that surface it has to stay wet based off what the disinfectant says it should stay wet for. So for example, if a solution says the contact time or wet time is 2 minutes, then that toy or that surface needs to be wet for 2 minutes. So that means that if that surface dries before that 2 minutes is up, then that means you need to respray that surface to keep it wet so it can effectively kill the virus. If it dries too soon, that means that the virus could still remain on the surface. So it's very important that if you have purchased a disinfectant, that you look very closely at the label and see how long that surface is supposed to remain wet for to kill the diseases it claims it can kill. And then with the bleach and water solution, it's either 1 minute or 5 minutes. I want to say it's 1 minute, and Alex or Maria could help chime in if they remember that. And I can certainly get that over to you all. But there is a specific guideline for that bleach solution, since it's not like a registered disinfectant. It's just another kind of solution you can make on your own, but we can give you what that contact or what time is. And then lastly, ventilation. Ventilation is your friend. I know we're in Florida and we deal with bugs, but if you have screens on your windows and want to be able to air out some of the air, or if you have, if you have ways to ventilate, though that never hurts, just to get that fresh air in the building and let some of that circulating air go out. So just something else to take into consideration if you're able to do so. Not necessarily saying you have to keep windows and doors open the entire day, but something maybe that you could consider doing at different points throughout the day if you'd like to bring in that fresh air and circulate out some of that recycled air. So vaccination. So again, with our attendees not particularly dealing with those that can get vaccinated at this time, but definitely encouraging staff that may be vaccine hesitant to get vaccinated. Because this is unfortunately not the best place for adults to be in that are unvaccinated, because you're dealing with so many people that unfortunately can't be vaccinated. So for right now, making sure that we are protecting the staff in your facilities is extremely important, because we do want to keep your staff protected. And the vaccine is not only going to provide them immediate protection, but will provide them much longer protection than the natural COVID infection can do. And the one thing that we do know about the COVID vaccine is that it is very effective at preventing severe illness and hospitalizations and death. That's been very well established. So at the end of the day, we want to keep your staff out of the hospital, we don't want to keep them out of work. So if they are vaccinated, that will provide them some coverage. And the other good thing with vaccination is that generally you're not required to quarantine if you're vaccinated. So it's another good positive step to get vaccinated, so that way you're not considered to be exposed and have to quarantine. But I will say with those that are exposed and vaccinated, that we do still say that they need to wear their mask correctly and consistently for the full 14 days after they're exposed. And monitor for symptoms. And if they do happen to develop symptoms within that 14 days, they should exclude themselves from work, and they should notify the owner operator of the facility. So that way they can make sure to stay home and get tested and see if they did come down with COVID. So we talked a bit about correct and consistent mask use. So very important that people are wearing masks. We are in a high transmission state. Really, most of the country is in high transmission right now. So it is very important that when you are indoors to please wear your masks. It is really a multi-pronged effort: vaccination, hand washing, cleaning and disinfection, mask use. It's a multi-pronged effort to stop COVID. So extremely important to make sure that mask use is being promoted for those that are recommended to wear them. I know that it's the under 2 population that we say should not wear masks. So I think everyone's aware of that recommendation, but in the event you're not, anyone 2 and older should be wearing a mask based off CDC's guidance. Physical distancing and cohorting is, of course, very important. So keeping those kids as best as you can. I know it's not the easiest in this type of environment, but trying to promote that as best as you can with maintaining distancing. And then in the event you need to cohort anybody, that's always great too. So that way, if there is an exposure, a whole bunch of people in other classrooms are not exposed. And then if there are a bunch of people that are exposed, and then there's others in a classroom that are not exposed, we can look at ways of cohorting the exposed separately away from those that are not exposed. But that would, generally speaking, not happen so much in this situation because we would be excluding all of those exposed individuals from the facility in the first place. But cohorting is a potential option we have if in the event that guidance changes and cohorting becomes a possibility. But trying to keep all of your students and staff from getting into one place really helps. I just do know that as in the beginning of the day, everyone kind of brings everyone together, and at the end of the day, they bring them together. So I know that can be something that does bring them together. And I know operationally that really is the best that you all can do to maintain them at the beginning and end of the day. So again, we just ask that you try to maintain as much distancing and separation as you can. And then lastly, and most importantly, if you get sick, stay home. I think that's probably been our biggest message. Please don't go to work sick. Please don't send your child to school or daycare sick. Please make sure they stay home if they have symptoms or they've been exposed and get tested. And if they're positive, then to stay home for the full 10-day period so we can make sure that they're safe. And if any of you need to refer them to somewhere for testing, prepareseminole.org is the website that the county has that lists out various places around the county where people can get tested. So we strongly recommend that you all keep that website handy, and you can share that with parents and staff if there's been an exposure, or if you want to push out, the information to parents and staff. So lastly, I just wanted to share some of the disease reporting contact information. So the main number you should keep at your number one is the COVID call center. So this is a 24/7 manned line. So from 8 a.m. to 5 p.m. Monday to Friday, this option will take you to a Department of Health staff member. After hours, this will take you to our answering service. So what we do ask is that the answering service is not Department of Health employees. So we ask to not give them necessarily any confidential information, but you can tell them, that your name and that you're calling from a childcare facility and you are trying to report a case of COVID-19. Or even if you just want to consult with us, maybe you got a call about an issue and you wanted to consult with us. You can call us and we can handle those questions and concerns. And basically what will happen is our answering service will get you in touch with our on-call epidemiologists. We are on call 24/7, 365. And so in the event you can't reach someone at the call center, we have some additional numbers I'll share in just a moment. So another phone number you should be very familiar with is our fax number. So our fax number is where you would be sending your line lists. So once you fill those out, you can fax those over. I was telling Jennifer the other day when she and I spoke that we are working on an electronic reporting submission service. And I know not even just for you all, but for everyone that's been doing the reporting with these logs, it will make your lives much easier and definitely our lives much easier. So we are exploring those options. I have a meeting tomorrow with our IT to work through those so that way we can get this up and running. So fingers crossed that all works out and I'll have a good process for you all moving forward. But for now, those will be reported through fax. And if you have any concerns or questions about that, again, you can reach out to us. And then lastly, our disease control Seminole email address, we definitely ask you keep that handy too. Sometimes if the phone lines are busy on our end and you want to send a quick email, say, hey, I'm trying to contact you about my facility. Can someone please call me? We do have people monitoring that inbox and we can get that message over to somebody. But again, same thing with this all of the emails for the Florida Department of Health are public record. So please do not send confidential. Don't send a name or a date of birth or your facility's information. If you can just send us your name and number and that you're calling about a childcare facility, then we'll make sure we get that to the right team to get back in touch with you. All right, so lastly, this is kind of like the triage of numbers you can call in the event you're running into issues reaching us at the call center. So you'll see the primary is the call center. Secondary will be Margaret, and you have her phone number here, and Arlene and her phone numbers here as well. And I know I sent those numbers out to Jennifer already. That I can get that out to you all if she hasn't already. And then the backup is Alex and Maria, who are both on this presentation as well. And as I mentioned, Alex is the childcare facility contact tracing lead. And then Maria is the COVID response lead that reports directly to me. Let's see. And with that, that's everything I have. So I will, I'm more than happy to open the floor up to questions.
I see a question in the chat box, Kevin. It's asking about the log, the illness log. One of the providers has asked if that's something we need to go back and fill out the logs from cases at the beginning of the first day of school. You really don't need it if the quarantine period's over and it's done, you don't need them to go back, correct? Just from this point forward.
Yeah, in general, yes. But what I will say is that if there are unreported, we would maybe just like to have a phone conversation with them just to make sure that we have the information about the cases, because another part of our job is linking people. So we may have, you know, that a child maybe outside, you know, maybe they were exposed in the facility but ended up testing positive or didn't return back to the facility for whatever reason. So in the community, we want to be able to try to find out how that other child got COVID. And if we can find out, hey, well, that person actually was exposed to that other case, then we can make that epi linkage. So all I would just ask is reach out to us and we can just have a quick conversation to see if there's anything that we can gather. But yeah, necessarily going back, if you have like 10 cases, I mean, that's quite a bit. If you maybe had 1 or 2 and are willing to submit it, if it's not too much, that would be great. But I would say at minimum, at least maybe give us a call and let's kind of talk it through. And I would say for that kind of instance, probably Alex would be the best person to reach out to. And then if Alex gets overwhelmed with those kinds of calls, and she can work with Margaret and Arlene to help field some of those calls as well. But generally speaking, yes, like for these lists, we can just talk about them being sent moving forward.
Okay, but it is a good point that this has always been part of the requirement, even as you mentioned when you opened other types of communicable diseases, COVID falls under that, and childcare centers should always be reporting to you all.
Correct. And we've been working for a long time on a childcare facility disease reporting toolkit. So it's just because COVID has taken so much of our time. I have it pretty much. It's pretty much ready. We just have to get it vetted. But it'll have all this various information on gastrointestinal diseases, respiratory diseases, rash illnesses. So we have different things that we can provide guidance on. So we'll be able to get that out to you all. But the main thing is if you have this Onus Report Log, this makes our lives a lot easier to report that. And it can be for GI, it can be for rash. And we can definitely send you all templates of line lists for GI illnesses and rash illnesses. That way you have those to report out on. And so that prepares you, so regardless of what the disease is, you have a log that you can fill out.
That's great. That helps you be more efficient as well. One other piece, because clearly you guys have nothing to do all day. I know you're completely overwhelmed with us, so we appreciate your time. One piece that I have reminded, so I wanted to remind everybody, is that when they call the hotline, to make sure that they tell, when they're leaving a message, make sure that they're stating that they're with a childcare center, so it gets routed to the right team to answer those childcare related questions, right? It should be very important if they leave a message that they highlight that piece.
Exactly. Just like I was saying, when reporting to the after hours line, it would be very, very helpful if they say that they're with a childcare facility, because that is going to help us know that this is a priority response and we need to move on it quickly. So absolutely, they should say that information.
I'm going to ask you a couple of other questions that I've heard in case nobody else is asking. someone asked about the last screen of numbers, and we actually emailed those phone numbers out in our most recent email list, but we'll send them out again to you so that everybody has them to make sure everybody's got access to those phone numbers. So we'll send it via email, Julie. You had mentioned that there were two strategies in dealing with a positive COVID case. You mentioned that the testing strategy and I think you called it isolation strategy, or maybe
so this is for close contacts. So not cases, but the contacts to cases.
Okay.
Correct.
Should childcare centers make their own business decision as to which one of those models they'd like to follow? Can they combine the models when one parent needs to come back before the rest of them? I just wanted to know, as these are small businesses and they're making those decisions, you've laid out two different options. Do they have to pick one and stick with it? Can they use both of them interchangeably depending on the needs of the family? Just wanted to ask about that.
Yeah, I mean, I would say it makes the most sense to try to keep some consistency, but what I will say is that most people, I mean, at least, and Alex can probably speak a little bit more in detail with if she's familiar with what most childcare facilities have reported doing. But a lot of parents, they want to get their kids back. So they're, trying to get that test at day 6, even if that frees them up a couple of days early from being able to return, it definitely helps. So Alex, do you have any kind of idea of what you've been seeing so far with childcare facilities?
Yeah, so what I've noticed so far is that it seems that the staff are the ones that are seeking diagnostic testing to return early, and students are waiting the 10 days, returning on day 11. I'm not sure if that's a facility decision or the parent decision on not wanting to test, but I definitely have seen more staffing seeking the shorter release than the students.
Okay. And I know trends are going to be based on what they're kind of hearing and their understanding of reading guidance. So just knowing that they have the alternative to do either one, is that PCR test appropriate for any age child? So if I have a 6-month-old, do they do PCR tests on 6-month-old?
Yes, because all we're doing is a swab. So the test doesn't impact on age. So yeah, so they can get whatever. Yeah, we definitely a PCR, yeah, regardless of age.
And the last piece, I know you had indicated the prepareseminole.org. A lot of times our families are lower income and they're struggling with the cost of something like a medical test, but you do have a list of free locations in Seminole County where families or staff members could go to get that PCR test if that's the direction that they want to take.
Yes, so Curative is a company that has multiple no-cost testing sites in Seminole County. Okay. So, and even if they don't live in Seminole County, pretty much every county has some kind of community-based testing option. So, but definitely in Seminole County, if they use Prepare Seminole, that will list out those Curative site locations. So they can visit that and see the nearest location to where they live. And they are doing PCRs. It does take a couple of days generally to get the results back. But the last time I looked at their website, like they had appointments galore. So they had plenty of time and space to take people.
Wonderful, wonderful. And one more piece, sorry, these are all just things that have come up in my conversation. So I wanted to share that. It's still recommended perhaps to check temperatures before children come into the facility when staff start their day. Is that still an effective technique? I know when the pandemic first started and we were trying to keep kids in their bubble, that was one of the screening mechanisms. Is that still an effective mechanism for screening?
I know that we generally have seemed to move away from that, but Alex or Maria, have y'all seen any updates to the guidance about temperature monitoring?
I have not seen any change. I know that some of the larger schools have sort of shifted away from universal temperature screening. It's something that they ask the parents to do at home. But I think it also is involved with the ability of the children and the age of the children to be able to report their own symptoms and self-monitor. So it would probably still be a good idea. At least that's what we recommend in Seminole.
For the little ones, especially the ones that maybe can't explain the situation. And we do understand with some parents, that temperature could be related to teething, it could be related to other things, but it's not necessarily worth the risk to have a child with symptoms in the center. So, okay. I think that's all I had. Does anybody else on our team have questions, or anybody else that participated today? We really appreciate your time, Kevin, Donna, and your whole team. Thank you so much for being responsive to our childcare providers. They're working really hard to help people keep going to work and do the right things for kids. So we appreciate all of your special attention to our industry and all of your support. So hang in there. I know you all are burning the candle at both ends, but we really do appreciate what you're doing.
Yep, and thanks for having us. We're more than happy to do this anytime you need it, any refresher that's needed, guidance changes, options change. So we're always willing to provide an update as needed to keep everyone abreast of the latest information. So just reach out to us at any time.
Fantastic. Great. Thank you. Have a good evening, everyone.
All right, thank you.
Thanks. Bye-bye.